Can you tell we're about to start if I come to the mic? And some people may, come on in, but I'm going to go ahead and try to start us at least close to on time. Tonight is our third program in our series, and it is on fall prevention. And I'm going to give you my own take on this because I don't think Nirmala will actually cover this part. When you're on a stage and you go to sit down, make sure all 4 legs of the chair are on the stage, okay? Just telling you, because that's what happened to me, 17 days ago. So I know that doesn't cover because we don't think of falling that way. And it's almost one of those things where it wouldn't surprise me if I tripped. Have you ever done this where you didn't pick up your feet far enough and you're walking and then you go and you kind of skid and you just know you're ready to go down, and fortunately usually you don't. Well, I'm 72 in 2 weeks, so I'm old enough to be one of those people you need to be concerned about falling. And of course, when I go to the doctor once a year for my Medicare checkup, not only do they ask you to remember these 3 or 5 words, I passed this year, but they also ask you things like, do you live in a safe place? Is it a safe environment for you? And then I remember the first time I was on Medicare, they started asking you about the throw rugs, right? So I think we're going to learn a lot more than just that. But fall prevention is really important as we age, that we take into consideration all the things we can do to not have that happen, because it can be life-changing. So I do want to introduce our speaker for tonight. We are very fortunate to have Nirmala Dhar as a member of our congregation and an expert in these areas that we're talking about. And I know expert isn't always a word we like to use, but so far, the material that she's provided is amazing. And the first 2 sessions are available to watch on video already. So, and they're on the Lake Os. Pam, are they on the Lake? You can get the access from the Lake Oswego UMC website? Oh, just go to YouTube and Google the titles? Or do you? Oh, Under Resilient Aging, the title of the series. Okay, so that's how you can find it on YouTube. Thank you, Pam. But Nirmala is a licensed clinical social worker with a master's degree in social work from many places, including Washington University in Missouri and Bombay University in India. Nirmala has worked in the public sector for 36 years in all aspects and programs of behavioral health in Missouri, New Jersey, and we're fortunate to have her here in Oregon now. She is a senior policy analyst for the older adult behavioral health and older adult behavioral health lead strategist for the Oregon Health Authority, Division of Behavioral Health. So I want to welcome Nirmala and have you all applaud her, because you're going to do that at the end too. So let's do it now. Thank you.
Is this okay? Okay. Well, thank you all for coming back. I see so many of you have returned, so apparently I'm doing something okay, right? So thank you for coming back. And one thing that we wanted to also mention, that this has been sponsored by the Abundant Health Ministries of the United Methodist Church. And as we have done in the past 2 weeks, I just want to kind of give you a few relevant scriptures to today's presentation. And so just to expound on abundant life, the way I look at it is abounding fullness of joy, strength of spirit, soul, and body. And I'd like to quote Ruth 4:15. He will renew your life and sustain you in your old age. And then Psalm 92, 12 to 14. The righteous will flourish like a palm tree. They will grow like the cedar of Lebanon. Let's see, the cedar of Lebanon, and be planted in the house of the Lord. They will flourish in the courts of our God. They will still bear fruit in old age, and they will stay fresh and strong and green. And that is Psalm 92, 12 to 14, which is the new English version. So with that said, I just want to bring your attention to some handouts which you all received. One is on what can you do to prevent falls, which is actually from the CDC. Thank you, Pam. And also some information on how to fall-proof your home, which is this larger handout. So with that said, this is our topic today, falls prevention, which is part of our Resilient Aging series. And before we start, I do have a disclaimer. This is a health and wellness or health wellness promotion talk, and in no way is intended to replace any medical advice that your doctor has given you or any treatment or intervention that you're on. Please consult with your doctor if you have any concerns after my talk today. So I just wanted to make sure we were all on the same page. So before we start, I always like a moment of reflection. I would like you all to just personally look at those 3 questions and answer them for yourself, yes or no. And this is just for you to do it for yourself. Have you fallen in the past year? Do you feel unsteady when you stand up or when you get up to walk or even when you're walking? Do you worry about falling? And if you said yes to any of these key, what we call screening questions, you may be at risk of falling. So we are all here today. Many people actually came to me earlier and told me their own fall stories. So, there are people in this room who have fallen. And Emily just shared her story that be careful how your chair is positioned on the stage. So yes, so there were several people who came and told me about their personal stories. And I told them I have, this topic is very near and dear to my heart because my dad fell at age 87. He already had metastasized cancer, but he fell and he shattered his hip. He had to have emergency hip replacement surgery. And at 87 with cancer, you don't really do well with major medical procedures. And he was delirious. He didn't do well with the anesthesia. The bottom line is, it was kind of a downward spiral after that fall. Yes, he had cancer, but I think everything just got hastened because of his fall, his hip fracture, and then the subsequent interventions for pain and for surgery. So this topic is very dear and very real for me too. Okay, look at that. 30% of Americans age 65 report falling every year. That means if we look in this room, every 3rd person would fall. 1/3 of us would fall at age 65 and older. And it is the leading cause of injuries and injury-related deaths for older adults. So 30%, it's like staggering, actually. And our population is aging. Did you know, by the way, that Oregon is the oldest state west of the Mississippi on the mainland? We have a median age of like 42 years old, and every day we are aging more. So currently our population is 22% older adults, that means 65 plus. And by 2030, that will have grown to 1 million Oregonians. That would be, we are reaching about 24% of Oregonians will be 65. Do you know why 2030? Do you know what's the big thing that's going to happen in 2030 in terms of this demography? The last of the baby boomers turn 65. So it is, President Obama is the last. He was born in 64. That's the last of the baby boomers. They will all turn 65. And so that's done with. We are done with the baby boomer cohort aging. But that's what's driving that number. And guess what? As we age, we are at high risk for falling. So falls happen to, so in the entire United States, every fourth person, but in Oregon, it's every third person falls. 1/5 end with very, very serious injury. But the good news is, it's preventable. You know, it's in the news. If you remember last year, the Senate Minority Leader Mitch McConnell fell. And he didn't fall once, he actually had fallen twice. Once he had a concussion, once he actually injured like his shoulder. You know, he's 81 years old. So it's all over the news in terms of older adults, significant or important older adults who have fallen. And look at the fall death rates. You can see the trend line, it just goes up with age. And we're going to talk about why do older adults experience such like grievous injury when they fall. I mean, there are younger people fall too, but it's very different when an older person falls. So they're very serious and obviously costly. So this is something to remember. Every 20 minutes, an older adult dies from a fall in the United States. And many more are injured. So it's a very serious public health problem in Oregon and in the rest of the United States. And I love that, take a stand to prevent falls. In fact, we were chatting earlier and I was telling Pam and someone else, is our church fall-proof? Is the church environment fall-proof? And that may be a good thing to audit and see. So why should we bother? All of us. Falls are a threat to the health of older adults. They reduce your ability to remain independent. Falls are not something that just happen out of the blue. And they're very serious. And the good news is, like I said, they can be prevented. Falls are also a marker of what we call frailty. That means frail older people are at higher risk for falling. If you're immobile, if you don't walk a lot, you are at greater risk. And if you have certain acute and chronic health conditions, and we'll look at some of them a little later. And falls in turn then diminish your functioning. Like my dad was like totally dependent for care after he fell and broke his hip. And he was a very big man, so it was my mother, who herself was 83, was unable to take care of him, so we had to have in-home care and all of that. But he lost much of his mobility and his independence because of like pain, and he couldn't really participate in rehab, as effectively. So yes, it diminishes your functioning. It limits your activities, what you can do. And then there is something called fear of falling, and we're going to talk about that. So what do they result in? Hip fractures, forearm fractures, humerus, pelvis. All of this combined affects falls, and one of the risk factors is osteoporosis. And we are going to look at osteoporosis too, okay? So I'm just giving you some statistics for Oregon, which is, this is the latest was for 21. They haven't published it for 22 as yet. As you can see, there were 213,000 falls in Oregon, with 802 people who died from a fall in Oregon in that 1 year.
So I assume that number is those that went for healthcare.
Yes.
Because obviously everybody doesn't.
Yes. Yes, so this is what is reported. Yes, it's probably a little bit higher than the 30% I'm telling you, yes. Yeah. And the deaths here are what's put on the death certificate, so that it was related to a fall. Yep. And look at that. It is the leading cause of traumatic brain injury in older adults. Older adults fall on their head frequently. It's the leading and highest among persons aged 75 and older. Remember I talked about frailty, chronic illnesses. Those tend to increase as we age, and so it places you at higher risk and leading cause of traumatic brain injury. And if you can see, the rate was higher among men who are older than women, and anyone wants to take a guess why? Risk-taking for sure. Yes, anything else? Women get diagnosed by osteoporosis much younger, and so they take treatment. Men don't, but men also get osteoporosis later. So they have much more brittle bones because they have not had, long-term osteoporosis treatment. So if you can see, the rate for males was nearly double than females for age 75, And they had the highest number of rates for TBI-related hospitalization. That means they ended up in the ER and then the hospital because of the head trauma, that they fell and hit their head. So it's pretty serious. So here are some more facts. I'm not going to go over every one of them, but each year 300,000 older people are hospitalized for hip fractures. And of those, 95% of hip fractures are caused by a fall. So it's not in automobile accidents or, some other risk-taking, like you were skiing or skating or something. No, it is you fall and have a hip fracture. And women fall more often than men and account for 3/4 of all hip fractures. So women fall more often. 800,000 people were hospitalized for a fall. And I've already talked about traumatic brain injury. Now, hip fractures. I told you women experience more falls and more hip fractures, though in that age group 75 plus with traumatic brain injury, men fell at double the rate than women. But for hip fractures, women fall more often. And women often have osteoporosis, at much younger ages, and they have kind of this, middle age onwards, they have these kind of weaker bones. But like I said, men too get osteoporosis later on in life. And look at that, the chance of breaking your hip goes up as with every 5 years of your age. The chance of falling and breaking your hip goes up. Dogs and cats as environmental fall hazards. How many of you have pets? Yeah, look at that. An estimated almost 87,000 injuries, falls are related to dogs and cats. Any idea what could be happening? They trip over, the leash gets caught, or they just come in your way and you fall over. Yes. There were 7.5 times as many injuries involving dogs as cats, and women were 2.1 times more likely to be injured than men with their pet, like with a dog or a cat. So absolutely, generally it is dogs were caused by being pushed or pulled when you're taking them for a walk or something on the leash. And then also tripping over your pet. So what can happen after a fall? The most obvious is obviously broken bones, like your wrist, arm, ankle, hip, and as Emily will say, her rib, correct? How painful that is. Head injuries, we've talked about that. Especially serious for people who are taking blood thinners for another medical problem, and if you fall and hit your head, you can bleed to death because you're on an anticoagulant. People become afraid of falling, and we're going to talk about that. And then it can be a life-changing and potentially life-ending event, like it was for my dad. So my dad passed away 3 months after breaking his hip. He did have cancer. His prognosis wasn't great, but his prognosis was not 3 months. It was the hip fracture and everything else that kind of hastened his death. So yes, it is often considered a terminal event when you are in like your late 80s. And that's what it says. It can be considered a life-ending event. Anxiety and falls. Remember, there was one question on the list of 3. Are you afraid of falling? Anxiety and fear of falling is very, very common after you've had a fall. You develop this anxiety that you're going to fall again. It's called fear of falling, the kind of anxiety. And what it does, it affects your confidence to navigate your environment, that you lose that confidence that, oh my gosh, I can walk around, I can take the stairs, I can get to the bathroom. And this ongoing fear, which lasts weeks and months, limits the person's life and paradoxically increases your risk for falling. Anyone wants to maybe hazard a guess why? Why would it increase your risk for falling, fear of falling? What would someone do if they are afraid of falling? Pardon? Okay, what else? They stop moving. They actually sit all the time because they're so afraid. Like, they don't stand, they sit all day. And what happens is it's like a self-fulfilling prophecy that you lose even more strength and muscle mass. And when you get up to do something, you absolutely fall. And so it's very, very dangerous, this form of anxiety, fear of falling. And so it's basically loss of confidence, that I'm strong, I can walk, I won't fall. It's just the opposite. You have this nagging fear in your head that I'm going to fall. And it leads to, activity restriction. And by the way, fear of falling is what we call an independent predictor of falling. Forget osteoporosis, anything else, throw rugs in your home. If you're afraid of falling, like this fear of falling, it predicts that you will fall. And here's the vicious cycle. So you fall once, then you're so fearful of the pain. The pain can be excruciating, right, when you break. My dad was like screaming in pain when he broke his hip. You're so afraid of the pain and of falling again, so you just sit in your chair all day. I'm not going to move. And then what happens is you're at increased risk of falls. And it becomes this kind of vicious cycle of fear of falling. Fall, fear of pain, and falling again. You don't do anything. You're kind of immobile. You sit all day, except for like the bare minimum, and before long, you fall. You get up and you have to do something, and you don't have the strength or the, or the muscle strength, and you fall, and you kind of do this self-fulfilling prophecy. And this is, by the way, a very real form of anxiety, fear of falling. We do a whole class on fear and falling for people who are afraid of falling. So, who have fallen and are not doing much. So, yeah. So why are the consequences so serious for older adults? People of all ages fall. Children fall, teenagers fall, young people fall. Why is it so consequential for older adults. Recuperating from a fall can be complicated and prolonged, especially with injuries such as like hip fracture or bleeding in the brain, from trauma, which can be fatal. As we age, our bodies are less efficient. We are less efficient in terms of our immune response, our kidneys, livers. It's kind of an accumulation of reasons why falls are like so serious for older adults. Older bodies mean that what would be a non-injury in your 40s would be far more serious in your 80s. Falls then are compounded by additional health problems. For example, osteoporosis, muscle weakening could be an example. And many other serious health problems. Like my dad had, aside from his cancer, he was a diabetic, and all those medications had to be stopped for his surgery. It threw him, it was bad. So it compounded the falls, all of his other issues. And then that frailty, the deterioration of multiple body systems, which put older adults at risk. Even when you have a minor stressor, you may have a very, kind of a minor fall, but it can throw you for a loop because you are frail. Older adults who are frail tend to have very weak muscles. They walk slowly, have low energy, are often very thin, like underweight, and have also lost substantial weight. So being frail is actually a significant barrier for recovery for people who are frail. And by the way, there is if you go to your doctor's office, there is a screening test for frailty. I mean, there are definite symptoms you have to meet to be, diagnosed as frail. So this is what the lived experience is of someone who falls. Reduced quality of life. You're afraid all the time. You're sitting in a chair. You're not going out to meet your friends. Perhaps you're not coming to Sunday, to church on Sunday because you're so afraid. Increased risk of like a nursing home placement. That's a fear, because remember I said it impacts your independence, and maybe your care partner at home can no longer take care of you because you need assistance to go to the bathroom, and that could mean, hey, we need to look at a care facility. So that's a fear, correct? Physical pain, actual pain. Confusion. Sometimes people have to be on pain medications, like they could be opioids or something else, which can cause confusion and memory issues. Cognitive decline. You're less sharp cognitively. Extreme anxiety, we talked about that. Sometimes it leads to depression. This vicious fear of falling kind of cycle can also spiral into a depression. And so all of this cumulatively really impacts quality of life. And so here are some risk factors. As you can see, there are individual risk factors, then there are environmental risk factors, and the intersection is where falls happen. So it's like a combination. And look at the individual ones. Age, cognitive deficits, if you're having problems with thinking and all clearly. Gait, strength, and balance, if you have problems with that. Sensory deficits like vision, and even hearing for that matter, but vision for sure in falls. Chronic health conditions, and we'll talk about some of them. Acute illnesses, and kind of like lifestyle choices, that you've made. And then look at what is, not kind of your individual, profile. Medications you may be taking can put you at risk for falls. Footwear. We were earlier talking about footwear. How critical it is to wear. The reason my dad fell, he was wearing flip-flops at home. He had bladder cancer, and he was running to the bathroom, and his foot got caught in the flip-flops, and he just crashed down to the floor and shattered his hip. So I can't emphasize footwear. Assistive devices, home or your home features could put you at risk. Using alcohol and drugs. And whether you have like a caregiver at home or not. So again, this is risk factors which are intrinsic. That means they're intrinsic, internal to you. Previous falls is a risk factor, by the way. If you've had a previous fall, that increases your risk of having a second fall. Muscle weakness. Gait and balance issues. Do you know what's a simple test for balance? Again, this is a health and wellness promotion class. So it is, standing without holding, and you raise your leg for 12 feet and just stand. If you can't, then you have significant balance and gait problems. And you should address it. And that's a test, by the way, that your doctor can do in their office too. The other one is called timed up and go. Anyone has done that test? Emily, you're saying you go for your Medicare wellness test. So it's basically they make you sit on a chair like this, and you have to get up and down from the chair without, you sit like this. So they're seeing the strength in your legs. And then they ask you to walk, maybe from here to where you are, and then back, and they time you. And the slower your gait, the more difficulty you're having. It's indicative of your cardiovascular health, and it's also predictive of mortality. That means the slower you walk, the more difficulty you have walking, within that time. It's called timed up and go. And then there are exercises. Actually, we are going to talk about how to improve your balance and gait and your speed of. So that's called speed of walking, how fast you walk. And then the other one is getting up and down from the chair. Look at extrinsic. So this is not internal to you. Lack of handrails. At your home. I've seen many people, their entrances, there are stairs coming up to their door, and there are no handrails. And I've seen people, I keep looking, oh my gosh, they're going to fall. It is so dangerous. There are no, and can you imagine in winter or when it's wet? Poor stair design. No bathroom grab bars. So these are all how you retrofit your home. Dim lighting. Tripping hazards. Like we were talking earlier about throw rugs. Even electrical cords. And we talked about dogs and cats, leashes. We are going to talk a lot about medications very shortly, and then slippery and uneven surfaces. And so these are some risk factors, are lower body weakness. And the one that I was telling you to get up and sit in the chair, that's called a box squat. And it's very good to strengthen these big muscles here, which are excellent for strength. So lower body weakness is a risk factor. Vitamin D deficiency. How many are vitamin D deficient here?
Probably, except I think that's
Everyone, pardon?
the interesting thing is my doctor told me this last Medicaid checkup, Medicare checkup, that the health insurance companies are no longer paying for authorizing vitamin D blood levels, which I think is really stupid.
Yeah. People living north of San Francisco, latitude, almost everyone is vitamin D deficient because of lack of sunshine. So that is actually a false risk, vitamin D deficiency. We've just talked about walking and balance, if you have problems with that. Use of medications, and we're going to talk about that. Vision problems. Foot pain and bad footwear, like my dad's footwear. Home hazards. And so they're caused by a combination. There's no one risk factor. They're generally caused by a combination. And the more risk factors you have, the higher your risk for falling. I just wanted to talk about pain and opioid use. You know, many older adults are prescribed pain medication, not just for fractures or anything, but also for, you know, musculoskeletal kind of disease like arthritis and other, at much very high doses. We looked at some Medicare data, and older adults were receiving, like, I think if I'm not mistaken, 4 times the dose of like younger adults. And you know, it should actually be opposite for older adults. We call it geriatric dosing, that you actually give smaller doses to older adults, because you know, your kidneys and livers are not, our kidneys and livers are not as efficient. But opioid use increases the risk of falls due to sedation, so you feel groggy and sleepy. We are going to talk a lot about orthostatic hypotension. And so those are, we'll forget about hyponatremia at this point, but really sedation and hypotension. So very important if you are on a opioid, you know, to really check how long should I be taking it? Is this dose actually okay? Is it putting me at risk for falls? And then there's alcohol also. Anyone knows what's the recommended amount of alcohol for people age 65 and older? Pardon?
1 drink.
Yes, it is actually 1 drink a day. And I can't tell you the exact ounces, but it's like 1 can of beer is 1 drink. And I think it's like 3 ounces of wine is considered 1 drink. Alcohol is, aside from it being a factor in suicide and all of that, burn injuries, 50% of fatal drownings and 65% of fatal falls are alcohol related. That means someone is inebriated or they are just groggy, you know, because they had alcohol and kind of missed a stair or took a tumble. In older adults, especially, too much alcohol can also lead to much more pronounced balance problems, balance and coordination than, say, a younger person, which can result in falls and hip fractures and other injuries. And then also, you know, older adults have thinner bones, like we talked about osteoporosis. So it's a combination of factors, but if you're having alcohol, you know, just be aware that it does put you at risk beyond what's recommended. Actually, now the recommendation is don't drink, but if you want to drink, have 1 drink a day. So after I've given you all this dire doom and gloom news, we are coming to the good part. Falling is not a normal part of aging. And you know, we all can do things to prevent it, which is the good news, that it's preventable. The first one is physical activity. And you know, we've talked a lot about it in our first class, which was Blue Zones Living, how important physical activity is. So also it's key to falls prevention. And you don't have to run a marathon or go and do half a marathon or work every day out at the gym for 3 hours. It could just be taking a walk, doing gardening, simple household tasks, dancing to music. Any of that is considered physical activity. In fact, in our first talk, we talked about gardeners have long life because they are doing low-impact exercise when they are gardening, you know. They're bending, they're lifting, maybe, you know. So any of these will promote falls prevention. Look at that. If you do this kind of exercise, and we are going to talk a little bit about it, it's called Tai Chi. 2 days, you know, more than say 2 days a week, it improves your balance. It almost reduces your fall risk by 25%, by regularly engaging in Tai Chi exercises. And this is, by the way, recommended by CDC, Tai Chi. And it's available all over the Portland metro area. A lot of the parks and rec programs offer Tai Chi. It's often free. Sometimes there's a fee. But I would highly encourage you to find out, you know, where is the closest Tai Chi class. And so, yes, so It is an evidence-based program for both arthritis and falls prevention. It's an effective exercise program for preventing falls and improving balance in older adults, whether you're healthy or you're at risk for falls. So, because what does it do? It improves balance and mobility, strength and flexibility, improve relaxation, and decreased pain and fall. And this is all like, we've done random controlled trials and all of that, that it says Tai Chi is one of the best things for falls prevention. So what is your secret to staying active if you want to prevent falls? And what comes in your way? Think about it for a minute, because that is one of the primary interventions for falls prevention, is physical activity. Here are 6 steps to reduce falls. I mean, first of all, talk to your healthcare provider. I like what you said, when you go for your Medicare wellness exam, which is free for all Medicare recipients once a year, maybe, have a falls conversation. Find a good balance and exercise program, like Tai Chi. Review all your medications with your doctor. Are there any medications I'm taking that puts me at risk for falls? Get your vision and hearing checked. Keep your home safe, and we're going to talk about that. And talk to your family members if you're afraid of falling, especially those 3 questions which I gave you at the very beginning. Did you know that if you do like a home safety audit and follow through on what needs to change, it reduces falls by 26%. And it's simple to do. Yes, you have to make changes though. And there's a handout you all got, and it tells you about some changes you can make in the kitchen, what changes you can make in the bathroom. So for example, in the bathroom, is the tub or shower floor slippery? Now you can get tiles with they are rough and they prevent skidding and falling in the shower. Do you have a built-in bench in your shower, where you can sit if you're feeling tired or you're suddenly feeling like dizzy, that you can sit on the bench in the shower? So have you retrofitted your home? And there are many other, that step stool. Is your step stool unsteady? My husband still climbs on one of those gigantic ladders to clean the gutters on a 3-story house. And this year I said, I refuse to help you with it. I'm not going to hold a ladder because you shouldn't be climbing that ladder. He's 65. I said, you shouldn't be climbing it. We should get someone to come and clean the gutters. So what are the home? Consider having a home safety checkup. And there are professionals called occupational therapists who can come and do like what we call a home audit. And if you're at risk for falls, your doctor can actually make that referral for an occupational therapist to come and take a look at your home and tell you what changes you should make. We've already talked about slippery surfaces. Throw rugs or loose carpets or mats. Remove them. Poor lighting. Items that are difficult to reach. So then you tend to stand on a chair or a stool and, you can easily fall. Electrical cords, which are long and unsecured. Oxygen tubing. If you're on oxygen and you have long tubing, you can trip and fall over the tubing. And chairs and toilets which are too low, or don't have those grab bars or arms for assistance. And by the way, this is all can be your bathroom can be entirely retrofitted with not any kind of like major renovation. Again, edges of stairs and surfaces should be marked. And that was something we were talking about the church. We have a little step from the parking lot, you step onto the, it's about this high. For many people who may have even some vision problem, you can't distinguish between, the street and that little, putting a bright fluorescent strip or painting it white on the edge tells people, hey, that's the end of the or that's where the curb starts. So that's a very simple thing to do on your stairs. Less clutter. We've already talked about toilets and chairs being at the right height. Night lights, non-slip, kind of pads in the shower. We've talked a lot about grab bars, and we've also talked about, handrails. Glasses. Single lens distance vision glasses may reduce falls. Single lens distance vision. Falls are prevented by getting rid of bifocals and progressive lenses for subjects with above median levels of outdoor activity. So if you're a very active person, it is best not to wear bifocals and progressive glasses. If you're not active, it may be okay. But for someone who's active, we are not recommending that. Here are all the conditions that impair eyes as we age. And by the way, they are all age-related, most of them. Cataracts, glaucoma, diabetic retinopathy, there is macular degeneration, just having to wear, glasses for vision. These are all age-related eye impairments, and they put you at risk for falls. When to use your distance glasses? Walking on stairs, indoors and outside, getting in and out of the vehicle, walking in buildings other than your home, walking in a garden that is uneven, so that's when you should wear your distance glasses. Use your bi, tri, and multifocal focal glasses when walking in your own home on ground level, sitting at a desk or table, driving, working at a bench, and when you're selecting items, from a shelf. Shoes. Shoes linked to an increased risk of falls include shoes with inadequate fixation. That means that they have no laces or straps, so they are like floppy, like my dad was wearing, flip-flops, so inadequate fixation. Increased heel height. Greater than 4.5 centimeters, or, almost 2 inches heels. Narrow heels, like those, stilettos. Reduced contact area for the sole. All of these shoes put you at risk for falls. Wear shoes with low heels, firm, slip-resistant soles, both inside and outside the home. In fact, they discourage you to walk bare feet and wear socks in the home. Socks make you slip. Even the ones which you think you have tread and all on it, it is recommended that you don't wear socks at home. So wear shoes if you have to, with laces in the home too. Know your medications. Which medications are linked to falls? Psychoactive medications, any medications with what we call anticholinergic effects, and some over-the-counter medications such as Tylenol PM. So any medications which include Benadryl in it. And look at the list. Psychoactive medications are antipsychotic, anti-anxiety drugs. Half of America is on a benzodiazepam. Hypnotics, which help you sleep, like Ambien or Sonata, they put you at risk. Some antidepressant medications. Opioids, we already talked about. Some are anti-Parkinson drugs. Anti-epileptic drugs, which are used for epilepsy, but they're also used for other reasons, but they can put you at risk. Anticholinergic drugs, which Benadryl is one of them, but those are medications for incontinence. Many people are on Detrol and Detropan for incontinence, but it puts you at significant risk for falls. And cardiovascular drugs, such as for hypertension, and diuretics, which are, kind of like those water pills, they all put you at risk for falls. So I want to talk a little bit about something called orthostatic hypotension or postural hypotension because it is a huge fall risk. What is this? When standing or sitting, suddenly, so you suddenly stand up, and or when you're anxious, your blood pressure drops. You have like a boom, like a drop in your blood pressure. You feel dizzy and lightheaded. You feel you're going to faint and fall. You suddenly feel this kind of weakness like, descending on you. You may also feel hot and clammy, that's all like anxiety. And you may also feel a little bit muddled and confused. And that all happens when you stand up or sit suddenly from that pause. So are you at risk for hypotension? First of all, ask your doctor, and then it's a very simple test. It involves measuring your blood pressure while you're sitting and you're standing. So first they take it when you're sitting, then they ask you to stand and take your blood pressure. And then the difference, the drop of 20 milliliters in mercury in the systolic blood pressure, which is the top number, within 2 to 5 minutes of standing, will indicate that you have orthostatic hypotension. And that puts you at risk for falling. Low blood pressure can be caused by any of these things. Blood loss, obviously from an injury. Dehydration, you haven't drunk enough water. Diabetes, heart problems, especially arrhythmias. Medications, especially medications used to treat high blood pressure, depression, and Parkinson's disease. And then if you're pregnant, all of these, those are some of the causes for hypotension. So how do you fix it? First of all, talk to your doctor, and then basically treat the underlying disease. Maybe you have to change the dose of your medication if you're at a high-risk medication. Sitting up in bed if you're on bed rest. So don't just jump out of bed and stand. First sit up in bed. They actually say wriggle your toes, do this to your hands, and so you're getting your blood, then stand up. Wearing elastic stockings on your leg. Any reason? Anyone knows why? Those compression socks? Yes, you were going to say something? Yes, it improves circulation, yeah, yes. And then taking fluids and salt if you're dehydrated. So how can you reduce further? Don't sleep flat, elevate your head, hypotension. Prepare before standing, especially if you're on high-risk medications, which you have to take, there's no ifs and ands or buts. You give yourself more time to move into a standing position. Like I told, wriggle your toes, wriggle your hands, and you get up like slowly. And have something sturdy to hold on to when you stand up. Move your muscles, march your feet if you must stand. Even when you're sitting, you can march your feet before you stand. Do isometric exercises. If you have one of those little squeezy balls, keep it at your desk or your table and squeeze them before you're going to get up because you're getting your blood flowing. So doing the rubber, soft ball, clench your hands, which all helps raise your blood pressure before you stand up. So what happens when your blood pressure drops? You are not getting enough blood and oxygen to your brain. You're fuzzy, you're dizzy, and boom, you fall. And you can shatter your hip. Improve blood circulation and blood pressure. That's why we're recommending those compression socks. They are not just good for long air flights. They are good to wear at home too for lengths of time. Many people wear it when they're flying on a very long flight, but it's very good to wear it at home too, compression socks. So there's very good research that vitamin D does prevent falls and bone fractures. So that means talk to your doctor about vitamin D supplementation. If you're not, if you don't already know whether you're deficient, because everyone didn't raise their hands when I asked the question, some of you did not. But there is a marked reduction in falls with a vitamin D supplementation. Recommended alcohol use, 1 standard drink each day, and no more than 7 in a week. That means not 7 at a time, means 1 drink a day, 7 in a week. And there, y'all can get access to the PowerPoint, which will be posted. It actually tells you like what's a standard drink. By the way, that recommendation for women, it's for women of all ages, 18 and plus. Women, the recommendation is 1 drink from age 18 onwards. Men, it is 2 drinks till age 64. And then, it drops to 1 drink for everyone age 65, 1 drink of alcohol. Okay, so really, if this is important to you, what's important to you? Many older adults tell me, including I'm an older adult, I want to be independent and be able to take care of myself. I want to get stronger. I want to be able to do more things that I enjoy. What are some concerns? My knees give out. I feel dizzy at times. My medications make me fall. I don't like to ask for help. Who is notorious for that with gender? Yes. Across the lifespan, very sadly though, men die in much higher numbers from everything from cardiovascular disease to like suicide that we talked about, in the earlier messages, other health-related, issues, because they don't have what we call health-seeking behavior. They're culturized very differently, socialized very differently. And so what happens is they don't seek help or they don't ask help. And I have seen it in my own husband. I have to pick up the phone and said, I'm going to call the doctor. And I call and I make the appointment. He will not do it on his own till he's like flat out, on his bed and can't move. But he will not go. And so I have to push and make the appointment. And that happens across the lifespan. And so there's something that we need to change about how we socialize boys and men, that it's okay to ask for help. That's the same reason why our veterans die at very high rates. They have like a double whammy. The military culture is also very macho and male. And then our mainstream society we socialize men, not to ask for help. It's not considered like masculine. To ask for help. Do you know which 2 industries have the highest rate of suicide in the United States? Hint, they are male-dominated. Not the military. Yes, construction. Judy should know that. She led a big work group on that. And what's the other one? Mining. Extraction, and now farming also, correct? We have a big campaign going on right now for farmers. But yes, construction, and these are all very male-dominated industries, construction, mining. It's changing maybe a little bit, but still very much male-dominated. And one of the things is they don't ask for help. What can you do? Talk to your doctor. If you feel any of those questions related to you that I spoke about at the very beginning, or any of what I said kind of resonates with how you feel, so that they can evaluate your risk. Ask either your pharmacist or your doctor to review your medication with the lens of falls prevention. Are there any medications that put me at risk for falls? And if there are and I have to take it, what can I do to prevent? Can you cut the dose down? And then ask about what we talked about, vitamin D supplementation. This is the United States, Prevention Task Force recommends exercise interventions to prevent fall in adults who live at home in the community, who are at increased risk, and they give it like a B recommendation. That's pretty strong, a B evidence. So that is something that they are recommending, exercises to stay strong. So what will you do? What changes will you make? And earlier I was telling Pam, what changes can we make in the church environment, to make it fall-proof. And so basically, we are all here today because we're going to take a stand to prevent falls. I have a whole bunch of resources here, which, if you want access to the PowerPoint, it will be available. This is an excellent resource which you can download. It is from the CDC, Preventing Falls, a guide to implement effective community-based falls prevention programs. And again, I really want to end with falls are not a normal part of aging. And we really want to promote resilient aging by preventing falls. So thank you all for being here, and maybe we can have one or two questions. Anything was like remarkable, or I didn't know that, or wow, that's something I can do?
Here's a question. If someone does fall, should they move? If there's someone with them, should they just stay there until somebody comes to help, until 911 comes?
It is, it all depends on age, frailty, all of those, if you can see how badly they're injured, all of that.
Obviously,
Yes.
if it's not serious, you could...
Yes, you can get up. Yes. If you fall. If you're able to get up, absolutely. Yes.
In talking about leashes and walking dogs,
Uh-huh.
I have learned over the years from physical therapists and have seen it happen to others. The retractable leads are one of the very worst things you can do to be walking your dog. You need to have a short lead where you're in control, because the longer the lead is, the longer space the fulcrum is, which means even a tiny dog, if it's out on the retractable lead,
Okay, really.
yeah, out there, can lift a person right down with a jerk. So if you have retractable leads at home and you're using them with your pets, please get rid of them and go to a 5 or 6 foot lead stabilizing one that you can then adjust the size in your hands.
Yeah. And that's real, what happens, unintentionally, pets can cause like a really bad fall. Any other questions? Anything? How many of you are maybe want to check out Tai Chi? One is just cardiovascular exercises, but also you have to do strength exercise and flexibility. So it's a combination of cardiovascular, strength, and flexibility, which will really be the ultimate in falls prevention. And if anyone is interested in Tai Chi, Pam, I can see, what are some local resources and send them, because they're available all over, because it is an evidence-based program that we are actually promoting in a very big way in Oregon, Tai Chi. Absolutely, yes. So you're going to lead us, get that going? No, seriously, yeah. Yes, absolutely. Okay, well, thank you all for being here again, and we have our last series lecture next week, and it's actually one of my colleagues is going to be talking on dementia. So please do come. He's a great speaker, and y'all will all like him, Rod Harwood. So that will be the last in our series. So thank you again, and Janine, as usual, has made some treats and some tea there. Thank you. get